MEC Dr. Nomafrench Mbombo. Thank you so much, MEC, for your time. Would you say that the province is out of the woods when it comes to the COVID-19 peak?
I think we were lucky when it comes to this variant for South Africa that in as much as that it is highly transmissible, but it didn't convert into the hospitalization, much of the hospitalization, and also much of the deaths. But it ended up having quite a large number of the healthcare workers who ended up being infected. But luckily, we haven't seen health workers who died during this time. But noting that it comes at the time that we have got the vaccination. Yes, indeed, for the Western Cape, we are exiting the peak, but we are still in the fourth wave because there's a technical definition of a fourth wave. We see, but some of the major metrics where it shows us that we're exiting the peak is the reproduction number, where now is less than 1. It means that people are not infecting each other as it used to be. The positivity rates, in as much as that we don't test as much as we used to test or we're supposed to test because of the differential approach when we are in the waves. But you still find that in numbers for those tests that we do, we find that the positivity rate also has dropped. And if you compare in terms of those who are hospitalized, because we get people who get hospitalized, but some of them, it's an incidental COVID cases. Well, it's not about the person went there because of the COVID, but incidentally, and then that's when they find that the person does have the COVID. What we have seen is about the oxygen use compared to the third wave. Because in the third wave, it was almost 400%, but now we haven't even gone beyond actual 50%. So indeed, things at least are getting better.
And listening to what you're saying around the deaths, yesterday I spoke to the South African Medical Association's chairperson, Dr. Angelique Cloete, and one of the things she was talking about is that when it comes to the deaths, it's going to be important to report as granular as possible because some of the people are trauma cases who may have contracted COVID-19 and they did not necessarily succumb to COVID-19 complications, but because they had COVID, then they might be lumped together. I wonder how challenging for you as a province has been that data collection, looking at these incidental cases, as you call them.
Yes, indeed. As I indicated, the issue about the incidental COVID cases. Luckily for Western Cape, we have got what we call unique patient ID, which is Nomafrench Mbombo, whether you go to in Vredendal in the West Coast or you go to Beaufort West in Central Karoo. If I'm still accessing the same health service in the Western Cape, I could be identifiable. So it makes it easier when now that record comes out for that particular patient. You could be able to see Nomafrench Mbombo, diabetic, was on treatment, and what was the condition if it so happened that I've been attending the health system. So we are able to remove that or to get access in regard to that specific information so that you don't end up having people where they'll say they died of COVID, yet I will find that they died of something else. So that information is accessible, but noting, I'm talking about those who are already in our health system. And also, we talk about the death, also with the access tests that are being conducted by the MRC, for us, we are able to make a follow-up and see these deaths that have been happening outside the health system, because most of the MRC get them from the Department of Home Affairs. How do we ensure to check whether some of those patients actually have been part of the health system and also have been positive? That's why we have always been very, very accurate when it comes to death, because immediately we get those deaths. That's why now we can be able to check and granulate and review and see whether indeed some of them were because of the COVID.
There are calls for GPs to be able to be allowed to administer COVID-19 vaccines, and this is in a bid to try and improve the numbers of, those that should be vaccinated. Booster shots are also available. I wonder, what is the uptake like in the Western Cape? Because when I listened to the briefing this morning, it does look like there are some areas for you that are showing higher numbers of vaccinated individuals, but you also then still have some areas where you need to pay special attention.
Oh, yes, indeed. It needs a whole of society approach. In the Western Cape, we have been working closely with the private, with the civil society, with the community, farmers, in regard to the access for the vaccines. As long as that, and also the opportunity, because we mustn't miss this opportunity, the opportunity of working all of us together, it takes us more towards the universal health coverage, where we could be able, people can have access of health services, what we call multiple entries. Because as a government, you don't have to monopolize. People should be able to go elsewhere, because at the end, we are unable to take all of these patients. That's why they end up waiting longer for us. So for us, we'll appreciate to work closely with that. And fortunately, South Africa does have, for example, the regulations on the management of notifiable medical conditions, where we can be able to tweak in regard to the vaccinations instead of only relying on the Disaster Management Act regulations. So for that part of it is possible, because you don't want a person to go to the GP for something else, and then the GP says that, that person says that I need a third dose, and then you say, go next door, and then you start another queue. So we welcome that approach.
All right, MEC, thank you so much for your time this evening. That is the Health MEC in the Western Cape, Dr. Nomafrench Mbombo.